Good morning, my dear friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel. Also, please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. You can also make use of it for continuous study. My dear friends, in the last class, the last two classes, of course, we have been discussing about adolescence care in Ayurveda, and we have seen some of the basic facts which is explained in Ayurveda regarding the adolescence period. The details we will see further. Before that, so we shall have a small introduction about the adolescence period. Now, adolescence is the period of craziness, as everybody knows. This is a period of hormonal hijack. The person or adolescent will be hijacked by the hormones, so he is doing everything according to the action of the hormones. So adolescence is a period of craziness, fantasy, dreams, tendency to build a new relationship due to hormonal influence. All these things are happening because of the hormonal influence, and there will be a crazy mind, there will be fantasy, a lot of dreams, tendency to build up the new relationship. There is a tendency to develop the personality and to create identity in the society, many things. Now, a 16-year-old boy or a girl, so whenever he attains the adolescence period, naturally he looks beautiful because of so many hormonal changes taking place, and the physical changes and as well as psychological changes which is taking place. And especially 16-year-old boy or girl always looks beautiful and also attractive or sexy for opposite sex, exactly for opposite sex, may not be for the same sex, but exactly the opposite sex will have this particular tendency. In this period, even the see, one of the Subhashita says that it is in 16th year, even the donkey also looks beautiful and sexy and fashionable. Then why can't the adolescents humans? This is the Subhashita says. Shodasha Varsha Prapte Gardaba Iva, like that the Subhashita goes. So even a donkey also in its adolescence period looks beautiful. Why can't the humans? Okay, so it's natural because it's the hormonal hijack. Now further, physical changes that we appreciate is rapid growth spurt. There will be rapid growth spurt, and there will be cognitive changes, and there will be a greater ability of abstract thinking and also goal setting. Previously there is no any goal setting. Now the adolescent boy or girl start goal setting, and more than that there will be a lot of emotional changes. Okay, there will be a lot of emotional changes, maybe aggression, maybe concern, compassion, many things. Emotional changes will be there, and tendency of independence, emotional stability, tendency of independent emotional stability. Previously, whenever there is emotional outbreak is there is a need of parents and all, or caretakers and all. But one thing that we can notice in the adolescence period is adolescent girl or boy, he tried to stabilize himself emotionally independently. Okay, these are some of the rapid changes which is taking place psychologically and as well as physically and physiologically also. There will be rapid growth spurt, height increases, because the sexual maturity is directly proportional to the bone growth. Okay, that is skeletal growth. So that whenever these hormones related to the sex are released, or hormones related to the genital organs is released, so naturally it causes the lengthening of the skeletal bones also, and even there is increase in the skeletal muscle mass also. So these all changes are taking place physically. Now growth is rapid. Okay, growth is very rapid in the adolescence period. So naturally what actually happens is even the nutritional requirement is also more, that we have to understand. And this is the main problem in India, in certain parts of the India, where during the adolescence, girls or boys, they are not getting the adequate nutrient, and that may lead to so many problems. So, okay, now growth is very rapid and nutritional requirement increases. 1/3 of the total growth occurs in the teenage years. We need to understand this fact. one third of the total growth occurs in the teenage years itself, in that 5 or 6 years of age. So maximum growth also occurs in the fetal stage. Okay, a zygote is converted into uh, 3.5 kg fetus, and it's not a small thing in 9 months. So that is also a phase of the rapid growth. Okay, and similarly, there are other growth spurts are also there, but one third of the total growth which we are appreciating, so that will going to occur in the teenage years. Therefore, teenage year has to be handled well nutritionally, psychologically, and physically. Now, the gain of the height, as far as the gain of the height is concerned, 5 to 25 centimeter of the height will be gained in girls, average 20 centimeter. So in adolescence period, average 25 centimeters of the height is gained by the girls, whereas boys the gain will be average about 23 centimeter. So it may vary from 10 to 30 centimeter, but average will be 23 centimeters. So little edge is there over girls when with the boys. So boys gain a little higher height compared to the females. Now, or girls. Now, boys, the pattern of genital secondary sexual development is very, very important. Okay, so what is the sequence? That sequence is very important. In the boys, the first thing which occurs is testicular enlargement. Second is increase in the penile length. Third is the appearance of the pubic hairs. And then comes the spermatogenesis, and then comes the growth spurt, and then comes the facial hairs. So this is actually the sequence, and the right sequence. This has to take place in this method only. Okay, so boys usually the testicular enlargement takes place first. This will be followed by increase in the penile length. Then there will be pubic hair appearance. Then spermatogenesis. Then comes the growth spurt. After spermatogenesis, there will be growth spurt, and then at the end there will be facial hairs. But compared to this in female, it is quite different, and that makes the height difference also. For example, in girls, first comes telarche. Telarche is a slight, that is appearance of the breast nodules. That's breast nodules. Usually happens 8 to 9 years. Telarche. Then comes adinarche, development of the pubic and as well as the axillary hairs. Adinarche, this shows the active adrenal gland. Then comes the growth spurt. Then there is sudden increase in the height. Okay, then there is sudden increase in the height, and this will be followed by menarche. This will be followed by menarche. See, in female compared to the male, this is difference. This is the main difference. What is happening in the males? Spermatogenesis occurs first, and then comes growth spurt. Equivalent to that in case of females, menarche happens first. Growth spurt happens first, then comes menarche. Okay, so but growth spurt will be after spermatogenesis. That means activation of this genital system, growth of the spermatogenesis, testis and all. Then comes the growth spurt. Whereas in case of female, especially growth spurt occurs first, and then comes menarche. Therefore, after menarche, the percentage of total height gain will be minimum in case of female. Okay, girls. In girls, what happens after menarche? Usually, they will not going to gain much weight. Weight gain, much height. Height gaining is there, but it is minimum. Whereas in case of male, it is different. After spermatogenesis, growth spurt occur first, and then, therefore, the growth after spermatogenesis, the growth spurt occur. Therefore, the height gain velocity is higher in case of male or girls or boys. So this is one of the major difference in SMR rating also, sexual maturity rating also. So this point has to be very well understood. Okay, growth spurt occur after spermatogenesis in case of male, whereas growth spurt occur before menarche in case of female, and this is one of the major significant factor which is responsible for slightly higher height gain in male. Now, growth spurt will be there for at least 2 to 3 years. Once occurs growth spurt, so that will be there for at least 2 to 3 years. Increase in the height is because of bone mineralization, or as I told earlier, skeletal growth. And there will be expansion of the longer bones. So in both the genders will enter the adolescence period. with the similar proportions of lean body tissue. Okay, in male and female, whenever girls and boys, when they enter into the adolescence period, uh, the proportion will be almost or similar as far as the body tissue is concerned. Muscle tissue, fat tissue, all these, when they enter into the adolescence period, in both of them, this proportion is almost all similar. But what happens afterwards what happens is, in case of male, the testosterone is there, which is responsible for more muscular mass, formation of the more and more muscular mass, heavier skeleton, and greater quantities and greater quantities, that is heavier skeleton and greater quantities of fat, muscle, etc. compared to female. The reason is testosterone. Okay, this is the nature of the testosterone. Testosterone bring all these changes. But in female, there will be estrogen. In female, there will be estrogen, which is responsible for more fat gain. Okay, in female, the estrogen is there. In place of testosterone in female, there will be estrogen. This estrogen is responsible for more fat gain than the muscle mass. So the adolescent boy will be more masculine, whereas adolescent girl will be little more chubby and fatty gain than the muscle mass, and also leads to initiation of the menstrual cycle. So this is a major difference. These hormones are making this particular difference. Now, adolescence age is managed properly, it leads to good lifestyle habits. Now, this is a very important thing, where the adolescence lifestyle is very important. Probably we are missing nowadays, so that we will going to discuss in the next class. Thank you very much.